Hi, Gabe.
There she is. Hi, Amanda. Thanks for joining us today.
Yeah, thanks for
Oh,
having me.
oh, great. So I am Gabe Ortiz. I am a physician assistant. I've been a PA over 30 years. I've worked mostly in pediatric pulmonary and allergy is how I know Amanda. I currently work as a clinical educator for Thermo Fisher, and we thought it would be a great time, Amanda, to talk about sports allergies in sports, given the fact that we are very close to the opening of the Summer Olympics, is why we've invited Amanda. You'll see that she has a wealth of information in this field. So I want to start off by welcoming Amanda and stating that this is in no way meant to be medical advice. These will be more than likely Amanda's antidote, and we will be talking about some treatment for patients, but not meant for medical advice. Always consult your own healthcare provider. So Amanda, tell us about yourself. Introduce yourself to our audience, please.
Yeah, hi, everyone. Thanks for joining us. So my name is Amanda Michaud. I'm a practicing PA in allergy and immunology. Been in this field most of my career for about over 12 years now. I also have a unique experience to talk about this topic today as a former college athlete myself and still very involved in coaching youth sports, specifically ice hockey in my area these days. So I think that gives me this really cool approach to talk about this topic. So thanks for inviting me.
Great, Amanda, thanks. So in light of your experiences, right, I see that you are a hockey coach. Maybe you can tell us a little bit more about that, right, in your background, which I know is interesting as well. Tell us about the patients that you see that may present to you, their symptoms, if you think they have some kind of allergic disease competing in these different types of sports.
Yeah, I think the biggest one that a lot of us think about is asthma. So we'll probably talk a lot about that on this live today. But there's also allergic rhinitis, the chronic sinus symptoms that patients can suffer from. Food allergy can also impact performance in different ways. We can touch on that as well. But the big one that comes to mind, I think, is the asthma side of things, because of course sport is associated with physical activity, and a lot of people with breathing or respiratory diseases and breathing issues may have asthma. In fact, I have some statistics kind of to share too. About over 30% of athletes have some type of allergic disease, whether that's eczema, allergies, asthma, food allergy, whatever it may be. But when they look further at that data, about 40% have asthma, and then that number's even higher in elite athletes. So we're talking about, of course, with the Olympics coming up a week from today, elite athletes, we're talking a lot about that their job is to train, and they really push the limits of what human bodies are capable of. But then we also have our recreational athletes, our youth athletes, the ones that are just still trying to be active on the weekends or, throughout their careers like me. So we'll see this show up in various ways. With asthma, of course, some of the telltale signs are, patients experiencing difficulty breathing, shortness of breath, chest tightness, and especially cough in exercise. And sometimes it's not very obvious, because a lot of times we'll see these athletes that, they're pushing themselves to a limit, and they're working really hard, and they attribute their shortness of breath to just the fact that they're working hard or skating hard or running hard, And I think that athletes, in general typically are in better physical shape than others, and sometimes they can minimize those symptoms. So it might not be obvious, sometimes not until after. Or in my practice, I'll ask my patients a lot. I'll say, compared to your teammates, so compared to your peers or your classmates in PE, do you seem to struggle more than them? Do you seem to have to take more breaks? And I'll word it like that and start that discussion. But even like allergies can play a huge role. And I think chronic allergy sufferers, like the sinus type symptoms, the classic like congestion, runny nose, difficulty breathing through the nose, and things like that. That's also very important for our ventilatory function and maximizing our abilities. And that can also impede athletes, not only with their symptoms, especially if they're doing an outdoor sport where they're exposed to a lot of their allergens, but also, other things indirectly, like affecting their sleep, of course, which we know is very important for physical performance as well. And there's so much we can do these days. We see a lot where patients come to my practice and they're told, you know, I can't do PE, or my son got a letter from PE or saying he can't do PE, when that's not okay with us. If that's the case, you know, then we're not doing our job, and there's likely more issues going on here that need to be treated. And thankfully, there's a lot we can do for patients these days, and tests, of course, that can point us in the right direction.
Yeah, thank you for that. Amanda, you bring up a couple of points. I really want to kind of dive a little bit deeper into probably more so the different kinds of allergies, right? Let's start with those maybe that are outdoor, maybe those seasonal environmental allergens. And then before I forget, I want to see how that differs versus the outdoor and the indoor. You have a very good inclination as to those athletes training, say like on ice, right? On ice hockey or speed skaters and things like that, which you have a good inclination for. But let's start with those maybe outdoor athletes, maybe summer athletes, maybe talking about some of those respiratory environmental allergens.
Yeah.
How does that present in the patients that you see?
Yeah, you know, it's interesting. You come to the allergy office. Typically, people get allergy testing. It's like when you go to Midas, you get breaks. You come to the allergy office, you get some type of allergy testing. And so a lot of our patients end up getting skin prick testing, because we can do that right at point of care. But there's also IgE blood testing as well, of course, that can give us that insight to their allergic triggers, which can be so important to understand why they are having their symptoms when they do. So I think of the classic patient. Soccer is really big out here. I have a lot of soccer players in my practice, a lot of high level Division I soccer players as well, competing at that higher level.
Right.
And the biggest thing that I think about with those patients, okay, they're allergic to grass. They may be playing on a grass field, of course, and exposed to that. But even if they're playing on turf, we see that these allergens get released into the air. The pollen just kind of float around, and they're found everywhere. They travel hundreds, sometimes thousands of miles. So even if you're not directly on that field, let's say you have grass allergy, but you think, this doesn't make sense. I'm playing on turf. Why am I having so many symptoms? It's because you're still surrounded by these allergens if you're outdoors.
Right.
And not just grass, it's also the weed pollens, the tree pollens, especially here where I am in Florida. Tree pollen is awful. That's why springtime is usually really bad for my patients here. You know, so that's kind of how that shows up. And then in the indoor setting, like, of course, with my experience with the ice hockey rink and skating and things like that, we may not have those allergic triggers, unless, of course, a patient could have both and then kind of have some symptoms carry over for when they're indoors as well. But in the indoor setting, in ice skaters, speed skaters, hockey, we'll see a lot of the irritant effects of the chemicals sometimes used to resurface the ice, which is kind of crazy, something I don't think about that often. But those Zamboni machines, and they release chemicals and things like that. And as we're skating, those particles kind of come up into the air. It's more of a particulate matter irritant effect in the airways and the sinuses. So we can see more of this non-allergic symptom, where the symptoms are exactly the same, but it's more non-allergic irritant causing it. So it can be really hard for patients without seeing that specialist, perhaps, to dive into these triggers more, who knows these details. It can be really hard for patients to figure out what is driving this. Yeah.
You know, and you bring up a couple of really interesting points, right? We're talking about, you know, having this discussion, which very timely, right, with the beginning of, close to the beginning of the Olympics. And we're looking at all of these athletes, right, that may have these allergic diseases. Amanda, tell us if you can recall, I don't know if our audience really knows some of the very famous athletes that may have some of these types of conditions, right?
Yeah.
And in their elite status.
Yes. So there's a lot. And when I kind of went down the research hole, kind of just getting that list of athletes to kind of mentally have in my head to talk about, there are a few that we already knew. It stood out. I know on this call, I have a lot of my athletes on. Hi, girls. So they might not remember some of these people. It was probably before they were born. But the one that I remember the most, that was really the first time that I really realized, wow, these asthma patients or people that have asthma can actually become elite athletes, is actually track star Jackie Joyner-Kersee. She is probably a big one that I remember from when I was a kid. And, you know, she's a boss, and she still did what she did despite having asthma. Another famous one right now, incredibly famous athlete, is Suni Lee on the USA gymnastics team. She has allergies and eczema, and she's actually very vocal about her journey with eczema, which is an allergic Th2 condition. A lot of swimmers and divers will have, you know, possibly some exposure to maybe the chemicals in the pool that makes them more at risk for developing this inflammatory pathway or activation of asthma. So other, you know, people that I think about are Greg Louganis, Tom Dolan, Dara Torres. I think back in the, you know, more recent year Olympics, I forget when she really was a big person in the swimming world, but can't remember the year exactly, but a well-known name. When we think of, you know, the winter athletes, Apollo Ono is a big one, speed skater, incredible athlete, but suffers from exercise-induced asthma. And my hockey players and the hockey audience watching this will be probably surprised to learn that Connor Bedard, who was the biggest name in hockey as the NHL's, you know, first draft pick recently, he actually has a nut allergy. Alex Lafreniere, who's also a previous #1 draft pick in the NHL, he has a nut allergy as well. Christy Yamaguchi, a figure skater, which also might be a little older for the kids that are on this, but that's you know, just a bunch of names, right, that come to mind immediately. David Beckham, he's got a lot of allergic conditions as well, EOE. So there are a lot. And the great thing that this illustrates is, of course, like we're seeing probably the real world, maybe non-elite athletes, but the great thing that this illustrates is that you can have these conditions and still be an elite athlete, which is incredible, because for years we would have patients and families that were told maybe they couldn't do these things. And then look at what these people have accomplished. And we're talking like the most elite athletes, professional track star swimmers, that really are putting the most stress on their immune system of their lungs and triggers and whatnot. So it's, I mean, then the list is endless. There are a lot.
And pretty surprising, right? So when you look up, right, when you look it up, in looking at trying to mention some of these elite athletes, you know, probably more so from my generation, surprisingly, Dennis Rodman, who was an incredible standout in the NBA, Jerome Bettis, who was a standout in the NFL, right? So you bring up a good point, Amanda. We're talking about these elite athletes that are able to compete at the highest level of sports, right? NFL, NBA, NHL, we're looking at Olympians, right? But one thing that overarching, right, of all of these is these athletes are able to compete at the highest level of athletic competition, right, with their condition. We would like to say that even anybody, what we talk about, you know, those weekend athletes, or maybe even just someone trying to walk around the block, right, should be able to do that with these allergic conditions in good control, right? So Amanda, tell us about, I saw a quick question here, maybe some of the symptoms, how you can diagnose that, how you would go about that, and then a little bit different maybe in the type of a warm-up that you would have for those maybe outdoor seasonal, say summertime athletics, right, versus those ice hockey or cold area warm-up rituals.
Yeah, and the warm-up is super important for people that have lung disease, because, you know, when you're just showing up to practice and just start running at the highest kind of level of intensity, you're more likely to trigger those, especially in the lungs, those bronchospastic responses, which really are, for those of you that are on that don't know what that is, that's basically the best way to describe it is the twitchy airways. Your airways just start clamping down and make it really difficult to breathe and get full breath in. So the warm-ups, in general, different patient to patient or athlete to athlete, depending on their sport and their specific triggers. But in general, the warm up is intended to kind of get the lungs kind of acclimated to that, rather than just going where I am in Florida when it's 95 degrees out and then you're going into a freezing cold ice rink. You want to get used to that kind of environment. Whereas if you go straight out and hit the ice and start skating as hard as you can, you're more likely to have symptoms. And when it's, you know, allergen induced or environmental allergies outdoors, that warm up might look different depending on the triggers. And even season, where we might have athletes that are only symptomatic or quite symptomatic during a certain time of year, that warm up might look different. if they have exercise-induced bronchospasm, or what used to be called exercise-induced asthma, they may pre-treat with medications to help prevent symptoms, or of course be on other preventative therapies to help treat their symptoms. When I think about how to diagnose this, it can be really challenging because not everybody does spirometry, which is a breathing test to diagnose asthma in the clinic, and not everybody has access to FeNO, which is exhaled nitric oxide, which is an amazing, super useful test to diagnose asthma, especially in young athletes with allergenic triggers. But the challenge even with spirometry is that we're talking about athletes that have super high lung function. So we can do a breathing test and it shows that they're like at 120% of where they should be. And they may be erroneously told they don't have asthma, but the proper full workup wasn't completed, which usually entails some type of challenge where we actually give them maybe a treatment to see if their lung function changes. And even those patients with super high lung function can go quite a bit higher with treatment. Another thing that we might look at is something called an exercise challenge, where we actually make patients that have even normal looking lung function, we make them exercise. We can do that on a treadmill. Depending where I'm at, if I don't have access to a treadmill, we will literally have them run around the building or do like jumping jacks in the office, anything that really gets their heart rate up and their respiratory rate up that can kind of trigger those symptoms for them. And we'll tailor that patient to patient. And then we look for a decrease in lung function after they're doing that. So there's a lot of different things we can do, but then sometimes it's really just symptoms alone that guide that. So one of the biggest things that stands out is cough with exercise. That is almost always indicative of asthma in children, especially. And those patients, again, it's kind of sometimes can be dismissed as, oh, they just worked hard, they just need to catch their breath, when it really can impede their performance. And then of course can be a sign of there being internal lung inflammation that long-term can become a bigger issue for them. So a lot of times that will show up as cough, wheeze, chest tightness, shortness of breath with activity, and even after the activity is over, sometimes even later in that evening, like you have practice at 6 p.m. and at 9 p.m. you're struggling. But sharing these symptoms with your provider or getting a referral to a specialist can really help to pinpoint what it is. There's also some other things that can mimic asthma as well, that we really see in a lot of athletes too. So yeah, it really kind of depends on the symptoms. Even we'll consider even the sport and the time of year that they're most active in how we manage and treat those patients.
Yeah, good points, Amanda. I really want to reinforce what you mentioned about really getting some really good information on your lung volume, right? Lung spirometry, FeNO, we know exhaled nitric oxide is a really good test, but as you say, it has to be that complete test, right? What we call the before and after bronchodilator to see if there's a change in the lung function. But I want to come back to something that we talked about earlier, you know, those outdoor, maybe seasonal allergens. A couple of things that's really important, as you mentioned, right? Identifying what those allergic triggers are. And a couple of really important points, right? Make sure that you pre-treat prior to your exercise, right? Whether it be for allergic rhinitis and or if you're having lower respiratory problems. But identifying those allergic triggers, and then some very wise information, right, is to avoid windy days because we know that pollen blows all over. You may get exposed. So keeping an eye on that, right? If you go outside, you think it's windy, you said probably not good to exercise now. And then pre-treating with your medication if that's necessary. But also something that can be done is following the pollen counts, right? So the advantage of identifying your seasonal allergens is you can follow the pollen on pollen.com, right? If it's a relatively high day, you may want to avoid. But tell us, do you give that type of education, and pretty much what is your patient's response when you tell them things like that? Do they know about those things, or have they not really thought about that?
You know, I always say a lot of patients are quite surprised when we talk about these little things that can make a difference, and tell them, hey, this is my job. You know, right. I know it's mind blowing to you right now, but this is my job to give you all this insight and feedback. So it's very interesting how powerful just the information of knowing what the triggers are can be, because some people are well controlled as long as they take their medication like they should, and a lot of allergy medication does need to be taken daily to kind of treat the symptoms and prevent symptoms. So a lot of times when we see consults, sometimes they just want that answer, that explanation, but they're actually well controlled. So those are the easiest patients to see, where we can just give them that education. It can be so powerful and validating to see, oh yes, no wonder my child who's a soccer player is having awful symptoms after they have a game all weekend or several games all weekend. It makes sense and it validates their concerns. But then we have, the uncontrolled patients. So we'll talk about, they may be very reluctant, and depending on what level of play they're at, they may not be able to miss practices without some type of consequence, right? So we'll talk about how to maximize their allergens we can control. So, a lot of patients, and especially in America, are polysensitized, meaning they're allergic to multiple different allergens. So we can focus on what we can control. We can't control the weather or pollen counts, unfortunately, but we'll focus on, can we control the indoor allergen exposures? Let's say they have a pet that they're allergic to, or they have a lot of dust mite allergy. What are things we can do to lower that? I use the bucket analogy a lot. Lower the water in that bucket so their symptoms don't present when that water overflows, or prevent that water from overflowing, really. So focusing on all the relevant allergens. And that's really what the guidelines say. We need to treat all of them. The idea being that we reduce their exposure to all of their allergens. Now, when it comes to pets, we really do work with families so they can keep their furry family members. I myself have dog allergy and 2 dogs that are here in this room with me today. So, we work with families on that, but there's still things we can do to prevent and reduce exposure and symptoms, even if they choose to keep the animal. The idea being that we lower their trigger exposure. And then when they are around these things outdoors, perhaps it's not enough to kind of spill over and cause symptoms. And knowing what they're allergic to and what the pollen counts are, so they can anticipate maybe needing to take a little bit more medication, knowing that, maybe they can have that conversation. I have several patients that have respiratory disease on my teams, and they know, hey, if you need a break, go, take your inhaler, go sit down. We don't push our athletes like that. And, we want to make sure they're safe and healthy. And so they might anticipate with knowing what they're allergic to, and let's say pollen counts are super high, even air quality really poor that day, and they can pre-treat with even more treatments. And a lot of providers and doctors and NPAs and NPs that treat conditions like this, they'll know what tips to give you based on your specific triggers and the time of year. They'll be able to offer insight on what's safe to do for your specific symptoms.
Yeah, great information, Amanda. Thanks for going over that again. We do have a question in the chat. I think we've pretty much answered it. How would my doctor diagnose asthma if I'm having symptoms? If you want to just go over that real quick.
Yep. So definitely reviewing the story and the history, learning about the symptoms, number one. We can't do anything without that, because sometimes lung function can, it's a hard test. I don't know if you've ever done a spirometry yourself, but it's a hard test sometimes. And it's challenging for even sometimes non-asthmatics to do perfectly right. So the symptoms and the history are so important, because sometimes a breathing test may not really look that great. And to the untrained individual might think that, okay, maybe this does look like asthma, but then you learn their symptoms and it's not really aligning with what you expect. So that's all part of the kind of detective work we do as well. And then we look at spirometry, and then I do pheno on every patient in my practice. Pheno is very powerful. It's a byproduct, it's a gas that's released when there's a certain type of inflammation in the airway. And that inflammation can really cause these ongoing symptoms. A lot of times allergies can induce higher levels of that. So it just gives us an idea of the type of pathway involved in that patient's symptoms, and gives us more of an idea of what's going on. That doesn't diagnose asthma. And even though spirometry, or the typical breathing test that we do for this, what we look for after an albuterol challenge, where we give that treatment and monitor pre and post, we look for at least a 12% difference in their lung function prior or after, a little bit less a little bit less in children, about 8%, 10%, depending on who you ask. But we look at that bronchodilator response and see, is this accorded with what we would typically see albuterol? If it's working, it should open up the airways. But then sometimes it's not really matching with what we expected. And that could be because they're not exercising. Then we'll do that exercise challenge. Or the guidelines even say, if you have high suspicion, despite normal lung function, a trial of a daily medication may be beneficial and is worth doing. And then having that patient come back and tell you. And sometimes, in the real world, we want to do the whole pre and post breathing test, but sometimes patients have other places to be, or another, sibling to pick up. And So we'll talk it out. We don't force our patients to do that test if they gotta leave, but we'll talk about, what, let's talk about starting this medication. Let's see how you do. And then, when you come back, your lung function theoretically should be better. And you should also be telling me you're feeling better. So there's several ways that we go. There's no test that is perfect at diagnosing asthma. We really, really have to incorporate the story and the background that patient's experiencing.
Yeah, good point. Really important, the history, right? Well, thank you, Amanda. It's been great information, really update, very timely, right? When we're looking at the beginning of the Olympics. You have any closing comments, anything else you'd like to tell our audience?
The biggest thing is that there is nothing limiting our athletes if they have allergies and asthma type symptoms. There's so much we can do now. And if you feel like you're not getting where you need to be or the answers you need with your primary care provider, then it's worth seeing a specialist, because sometimes, we really need our expertise to give the right guidance and the right education and make that diagnosis. But if you're feeling limited at all from a physical perspective, come and see us, please.
Right, exactly, right. Always communicate with your healthcare professional, give them the information, be upfront, be honest. It shouldn't keep you from exercising, as I telling you that, I heard someone say, I can't exercise because I have asthma. Well, we want to make sure that you get good control, right? Feel good so that you can exercise.
Exactly.
Well, thank you for being with us, Amanda. I appreciate your expertise, your information on all of this very relevant and timely information. Thank you for being with us.
Yeah, thanks, Gabe.
See you.
See you later.